My name is Noah Kim, and I will be diagnosing you today. What's your name?
My name is Dr. Abdullahi.
And what's the patient's name?
The patient's name is Hawa Abubakar.
Nice to meet you, Hawa.
Yeah.
So can you ask her if I have permission to ask her questions about how she's feeling?
Hello, can you see Hawa? Can you see our patient very well?
Yes, I can see her.
All right, that is Hawa. She's our patient. So go ahead.
Oh, I can ask? Can I start asking
So
her
go ahead.
questions? Okay. So could you ask her why she's in here today? Like in what way she's not feeling well?
Oh, she came here because she's sick. Can you see she's looking sick?
Um, Not too well, but yes, I could see her still. Does she, could you ask her if she has a fever or if she has
Yes, she
had
has
fever?
fever.
Has
She
it
has fever. She has fever and abdominal pains for 2 weeks.
abdominal pains for 2 weeks?
Yes.
Are the pains severe or are they mild or moderate?
Yes, she has mild pain on her abdomen.
Okay, and then she has a continuous fever?
She has continuous fever.
Does she also have any dizziness or weakness?
She has weakness, but no dizziness.
No dizziness? Okay.
Yes, she
Does
has weakness.
does she have any cough or throat soreness
She doesn't have cough,
or any runny nose?
no running nose.
All right. So, can we run a blood culture test because she's just showing signs and symptoms of typhoid fever?
Yes, we have done a blood culture and it was positive.
It was positive? Okay. And then
Yes.
with typhoid fever, she might be anemic too. So,
Okay.
and she also is weak, which is a common sign of anemia. So, could we also run a hemoglobin test or
Yes,
hemoglobin
we
count?
have done hemoglobin and our hemoglobin is 11.5 gram per deciliter.
11.5 grams? Okay.
Per deciliter. Yes.
So, right now she is showing signs of typhoid fever, and her abdominal
Okay.
pains are a very common sign. So,
Yes.
to treat this, I would suggest using IV antibiotics,
Okay.
and that should help her. And then to prevent this in the future, she can keep good hygiene, have good
Okay.
sanitation habits, and then could you
Okay.
ask her, does she get her food from vendors, like independent vendors?
Yes, she get her food from vendors sometimes.
Sometimes? Okay, so sometimes
Yes.
vendors, their food can be,
Yeah.
sometimes it's trustworthy, sometimes it's not. So just to be safe, just make sure that you're getting your food from a trustworthy source.
Okay.
And then her
All right.
hemoglobin level seems pretty good.
Okay.
It's relatively low, but it's barely low enough to cause any major issues. So if she does want to
Okay.
raise her hemoglobin levels, I suggest some like diet improvements, so getting more iron, minerals, and
Okay.
electrolytes, and hydrating more, and that
All
should
right.
prevent her from getting any weaker. And
Okay.
also, if necessary, she could also take supplements, but because her hemoglobin level isn't too low, it shouldn't be too much of an issue.
Okay.
So, and
Okay.
then if she keeps a good diet and stays hydrated, then it should get
Yeah.
better.
All right. That's interesting. Actually, I'm so amazed by this your discussion and diagnosis and treatment.
Thank you.
You were able to diagnose typhoid fever in Hawa, and Hawa presented with features suggested of that. She had complaint of fever and abdominal pain, which suggests typhoid fever.
Yes,
And
thank
you know
you.
the fever is continuous.
Yes.
You know, it's not
Yes.
an on and off fever. And typhoid fever causes on and off fever, unlike malaria, which causes an on and off fever. Typhoid fever causes continuous fever.
Yes.
And you ask other features like leg swelling, chest pain, just to be sure that she doesn't have anemia or she has just ARI.
Yes.
So I think that is good for you to have made the diagnosis and try to exclude other possibilities.
Thank you. Yes.
And you have gone ahead to do investigation. You requested for the blood culture, which was positive. You also did hemoglobin, just in case she has anemia, which is okay. And you have treated her with antibiotics, which is what is used for treatment of typhoid fever. That is excellent. You have gone further to talk about whether she takes her food from vendors. And sometimes, you know, the food can be contaminated with bacteria. The typhoid, the Salmonella typhi, the cause of typhoid fever, the bacteria that causes typhoid fever. You know, it can be contaminated from an unhygienic food. You understand? And that can be gotten sometimes from the vendors. Hello?
Yes, I can hear you. Sorry.
Yes, so your advice, we'll pass that advice to her what? We'll ask her to make sure that she avoid getting her food from vendors, to make sure that she takes clean water and ensure good environmental hygiene so that she stay away from the bacteria that causes typhoid fever. Thank you very much.
Thank
We
you
are
for your
really
time.
amazed. We are really happy. Hawa is happy. She is saying thank you for making this diagnosis. Can you see her waving her hands?
Yes, I can.
Yeah.
Tell her thank you for her time.
I wish you are my doctor so that you treat me like this. I like people that make this kind of diagnosis. You think? You understand?
Yes.
I wish you are my doctor.
Hope to become one later, maybe.
Yeah, you will be one, God willing, so that we join hands together and do the business.
All right. Thank you.
All right. Bye bye. Bye bye. Thank you.
Bye. Thank you for your time again.